So recently there's been much talk about and much literature on gluten-free diets, and it's really become in vogue. So I'm going to be spending a few moments talking about gluten-free. Is it really necessary? Is it really of benefit? And who may benefit from a gluten-free diet? So gluten is a protein which is found in wheat. It's also found in rye and barley and sometimes in oats contaminated with gluten. So these foods are commonly found in bread, in pasta, and even in some drinks such as beer. And a wide range of other processed foods such as sauces contain these grains and contain gluten. About 1% of the population suffers from a condition called celiac disease, and this is an immune condition in which there is a true intolerance to gluten, which can actually damage the lining of the gut. Patients with celiac disease may suffer from anemia, weight loss, poor absorption, and even bowel cancer if they continue to consume gluten long term. So for this small 1% of the population, a gluten-free diet is absolutely necessary and even life-saving. A further 1 or 2% of the population may suffer from a true wheat allergy. In other words, they have wheat, they might get hives, asthma, rashes, and they should, of course, avoid all components of wheat, including gluten, while they are suffering from the allergy. So wheat allergic patients certainly deserve a gluten-free diet. However, this leaves the remaining 96 to 98% of the population. And in this percentage, this large proportion of the population, there's actually very little scientific evidence to support a gluten-free diet. However, it's become such a popular trend that 15% of Britons and 25% of Americans are attempting a gluten-free diet. It's become a multi-million or probably a multi-billion dollar industry. Gluten has been blamed for a wide variety of symptoms, including headaches, weight gain, even attention deficit disorder, with very little scientific backing. There may even be some problems with a gluten-free diet. For example, a gluten-free diet may be deficient in fiber and result in an increased fat intake. The alternative grains, such as rice starch, may have a much higher glycemic index and lower nutritional value than gluten-containing foods. A gluten-free diet is expensive. The last disadvantage of the gluten-free fad is that it actually undermines those who really truly have a gluten sensitivity. So for those people with celiac disease, those people with a wheat allergy, they may become diluted by people who claim to be gluten intolerant and by the big gluten-free drive. We really owe it to those patients to recognize they have a true gluten problem and to institute the right treatment for the small percentage of the population. But once again, for the vast majority of the population, gluten-free has no proven benefit.